I will be talking about what OHDI has done with regards to activities before the WAAW 2023 and also what we did during the WAAW 2023 and what we have in plans for next year so that everyone here can know how they can come in play if they want to volunteer with OHDI on AML and prevention, AML control and prevention efforts. Thank you. So if you've been following OHDI for a while, here's a bit about who we are. OHDI is a local non-profit organization, and we are focused on addressing interrelated issues of AMR, of One Health, sorry. It's interrelated issues that are in the animal, human, and environmental space using the One Health approach. And AMR is one of those major interrelated issues because it's a multi-sectoral issue. It is multifaceted. It cannot be combated alone by humans or by the people in the human health sector or animal health sector. It is everyone that has to work towards it. And this presentation will give you an highlight of the advocacy project and the achievements we have so far with regards AMR and also what we have for 2024. Some of the advocacy projects we've carried out include the World Antimicrobial Awareness Week 2022, the Antimicrobial Guardian Campaign, the NAP on AML campaign, the AMS Compendium, and also the World Antimicrobial Awareness Week 2023. So I will start with the World Antimicrobial Awareness Week, or currently World AML Awareness Week 2022. So for the event, which was last year, we implemented a campaign. We started with a short video on AML that introduced our public to what AML is all about and how they can also join the fight towards combating AML. Consider the fact that OHDI is youth-oriented and also inclusive when it comes to youth participation in public health implementation, with regards public health policies and the likes. We had a webinar to especially discuss about youth involvement in AML, and we had a social media campaign that was mostly, involved youth to talk about AML in lay terms towards the lay public. Our aim then was to communicate AML to people who do not understand AML completely, people who are non-scientific community. Aside that, we also had a concluding webinar to ensure that people can continue to talk about AML even after the WAAW. We also designed a brochure that talked about AML in lay terms, and it discussed things that general public can do with regards control and preventive measures. And through this program, we were able to encourage about 32 active volunteers, which is 90% youth, from different disciplines across Africa to contribute over 200 posts on AML in various social media platforms, which of course benefited thousands of people about when it comes to AML. We also created a platform for AML enthusiasts, the people that would like to continue actions against AML. And the platform currently contains about 115 participants. Here are some of the visuals for the activities that we had. If you look at the far left, you would see the flyer for the first webinar we had. In the middle, we have that of the social media campaign. Towards the right, we have the concluding webinar flyer. All right. So for this year, as a sequel to our efforts last year, we kickstarted the Antimicrobial Guardian campaign. It was more like a campaign to get everyone ready and try to seek commitment from individuals with regards to AML. So the answer of the campaign is to go to the Antibiotic Guardian Pledge website and take a pledge to be a steward of antimicrobials. And we're able to see several people taking that pledge. In fact, we saw several people that got interested in our posts. And when we checked the page, several of them are taking the pledge and also shared on social media too. That is a visual about the pledge. It's still ongoing, of course. If you'd like to do so, we'll be happy to have you. You can also tag One Health and Development Initiative using the hashtags that have been provided, or just mention us in your post. Okay, so aside that, we also had a campaign on the National Action Plan on AML. So this was more like a sequel to the research that we carried out in 2021. So we tried to understand the awareness and the implementation level of the National Action Plan for AML amongst concerned health stakeholders in Nigeria. That is, health stakeholders in the animal, human, and environmental sector of Nigeria. And to inform people, because during the research, we realized that several people knew nothing about the National Action Plan on AML, in fact, including health stakeholders. So to ensure that we can create an awareness on this, we launched an awareness campaign earlier this year to create awareness about AML and also the National Action Plan for AML. Aside that, we also engage youths to participate in this awareness. And you can see in the, next slide. As you can see in the visuals presented, towards the far left, we would have the first webinar that we had, which talked mostly about how youths can contribute to the National Action Plan and also its implementation both in Nigeria and also in Kenya. And if you look at the middle, you would see the social media campaign that we had that encouraged youths to participate in awareness creation when it comes to National Action Plan for AML. Then towards the far right, you would see the concluding webinar that we had to talk about the gaps that were identified in the National Action Plan and recommendations for future implementation and also the design of the National Action Plan 2.0. After realizing that in some ways, the animal healthcare sector is actually marginalized when it comes to AML. You would see that oftentimes when people talk about AML, they only talk about the use of antimicrobials by humans, how we are misusing it oftentimes. Of course, the animal sector is mentioned, but briefly. But come to think of it, based on research and also literature review, we realize that a whole lot of improper antimicrobial use happens in the animal health sector. Because if we look at it here in Nigeria, we don't really care much about animal welfare, which is something OHDI is also trying to champion to ensure that proper animal welfare is done for various animals, pet animals, and the likes. It's not something that we care about in Nigeria. And because of that, we misuse antimicrobials while taking care of animals. So in realizing that, we focus squarely on ensuring proper antimicrobial use in animal healthcare, which is why we launched the AMS Compendium project. And the essence of this project is to collect best practices, global best practices when it comes to AMS in the animal health sector. And these practices are gotten from policy documents, from research articles, from documents in organizations like NCDC, the World Organization for Animal Health, and several others like that. We collected all these documents, we reviewed them, and we're able to create informative sections for targeted audience. Some of our audience includes veterinarians, veterinarians, animal pet breeders, pet owners, and several others. Of course, when we release this AMS compendium, you would see several of these things. In fact, this compendium was very, very vital in producing the IEC materials we used for the WAAW 2023 outreach, and we are looking towards further verifying this AMS compendium and releasing for public use so that organizations can also benefit from what we have collated. So as mentioned, in the WAAW 2023, we utilized the AMS compendium to create targeted information for different audience. Our aim was to create AML awareness in the animal health sector and at the same time address AML awareness in the general public. We also want to include youths in our activities. This is why we launched a physical outreach at the center of Batio in Ibadan, in which we were able to reach over 4,000 people, and that includes butchers, cattle areas, general public, market vendors, and several others. In fact, a collation of all the activities that we had that were in the outreach is currently on our social media. You can look for a short video on that on our social media platforms. And we're able to educate them using the IEC materials that we developed. We also translated these IEC materials into indigenous languages. Yeah, that is Yoruba language, which is most common in Ibadan. And we're able to engage with them one-on-one to talk about AML. Aside that, we also had an essay competition for undergraduates to draw out innovative solutions towards tackling AML. And our aim was to ensure that undergraduates can reflect on how they can combat antimicrobial resistance in Nigeria and how they can also contribute to the fight. And of course, we are going to be talking about or presenting the winners for this essay competition in this webinar. And we also had a social media campaign, which also involved youth, with our partnering social student associations, which includes the IVSA Nigeria and also the Africa Public Health Student Network Initiative Nigeria. And they were able to post IC materials on social media, across all their respective platforms. We also had we are also having a concluding webinar, which is currently happening to foster and promote continuous youth actions against AMR after the World Antimicrobial AMR Awareness Week. Yes, that is a copy or a picture or visual of the IC material which was sent to Yoruba language, which was well welcomed by several of the people we met during the outreach. Okay, that's a picture of some of the activities we had during the webinar, during the outreach, sorry. You can see members of our volunteers there, 16 total volunteers from the IVSA Nigeria and also from the Africa Public Health Student Network Initiative Nigeria, who really contributed towards the initiative. We had public awareness, we engaged them one-on-one, we gave them the brochures to continue AMR education. So we would like to say a profound thank you, appreciation towards our volunteers from partnering student associations in Nigeria, and that is the IVSA Nigeria and also the Africa PHS in Nigeria. Thank you for your collaboration, and we look forward towards more youth involvement in our actions, which is why we present some of the plans that we have for next year. A major part of the plans we are proposing for next year is a pilot extensive AMR education program at Akoko, Odo State, which we are going to be doing in collaboration with a student organization in the Adekunle Adesuyi University, Akoko, and also in collaboration with AMRI, which is a tertiary institution association fostered by lecturers across all tertiary institutions in Nigeria towards antimicrobial resistance. And this program is targeted towards youth undergraduates in Adekunle Adesuyi University. As it is said, it's a pilot program, so we look forward towards expanding to other universities in Nigeria and ensuring that everyone takes part in the fight against AMR. We'll also be having a monthly AMR chat to ensure that our discussions on AMR does not stop here. We don't want everyone to just listen after this webinar, everybody goes home and nothing is done until the next WAAW. No, we want continuous discussion that forms a reminder and keeps us, active and well motivated to contribute towards AMR prevention and control. We are also going to modify our AMR WhatsApp group, which is our platform, to ensure continuous dissemination of AMR-related news, updates, and opportunities. A link towards that platform will be shared in the subsequent weeks to ensure that you can also join. You can follow us on social media for that link and other resources we'll be sharing. So you can also join the platform and participate in our monthly discussions and several other opportunities that will be shared. We are also going to provide resource materials for AMR awareness and advocacy. So how can you contribute, which is the main aim of this webinar? How can you contribute as a youth? As a youth, one of the things you can do to contribute in our plans is to volunteer at OHDI. You can do so by reaching out to us at info@onehealthdev.org. You can also look out for our call for volunteers and also other call for applications that we do post on our social media platform. To ensure that you can get all these updates, it's necessary that you follow us on social media. We are on LinkedIn, Facebook, Twitter, and also Instagram. Aside that, you can also join our AMR Enthusiast platform for our program updates and also the resources we'll be sharing. And the major thing, please use antimicrobials appropriately, either in animal health sector and also in human. If you have pets, follow the instructions with regards to AMR use. If you are using it for yourself, make sure you get a prescription. Aside that, be an antimicrobial steward. Advocate for antimicrobial resistance. Educate people about it. Tell your friends, tell your families. Let everyone know that AMR is a prevalent issue in Nigeria, and we should all do our best to combat it because before it gets out of hand. Aside that, this will be the end. This will be the end of this presentation. Thank you very much for listening. I welcome all questions during the Q&A session, and that's it.